Amazing. Our first presentation today is from Milwaukee County Wraparound. It will be presented by Leanne Delshart, who is the Integrated Services Manager of Strategic Initiatives for Wraparound Milwaukee and owner of L&D Consulting. For the last 19 years, Leanne has worked with children and families affected by trauma, adversity, and mental and behavioral health challenges. Leanne has a long history with Wraparound, starting her career as a development and starting her career as a care coordinator for Wraparound Milwaukee before moving into supervisory program development and administrative roles in human services. Our next presenter will be Dr. Panina Goldfarb, who came to Milwaukee in 1976 to teach at the University of Wisconsin-Milwaukee as a special education professor, focusing on the disciplines of emotional disturbance and child psychology. Presently, a researcher for Children's Community Mental Health Service and Wraparound Milwaukee System of Care, Milwaukee County Behavioral Health Services. She's been an educational diagnostician, a school principal, and has had extensive supervisory experience of departments and programs and staff. We are so excited to welcome these presenters here today, and we cannot wait to learn more about Milwaukee Wraparound. Thank you.
Thank you. Thank you for the opportunity to be here. We are very excited to share the work that we've been doing and to learn from you all as well. Again, thank you for the opportunity to share what we've been up to. So with Children's Community Mental Health Services and Wraparound Milwaukee, we've grown quite a bit over the years since we began. We began in 1995 with a grant. And it was sort of the 25 Kid Project. And we were able to work with 25 youth who were identified by systems as having incredibly complex needs, who had really grown up in institutions. And we really wanted to find a way to sort of wrap services and supports around young people and families in order to move toward, under the wraparound philosophy and model, move toward more community-based care. We believe that young people belong in their homes with their families and in their schools, and wanted to really find a way to serve complex needs and meet complex needs in that environment. So the grant helped us to begin that process, and we've since grown into a blended funding model, which I'll share with you in just a moment. And then we've had opportunities, largely grant funded opportunities for expansion over the years. So in 2007, Medicaid allowed us to expand programming by 200 spots. And we decided at that point to move upstream. Prior to that, we had served only young people who were also on court orders, either a youth justice order or a child welfare order. And we thought we really wanted to be able to connect with young people and families who are in need of care and support prior to any court involvement, with the hope of preventing it. So we began the REACH program at that point for young people who were not involved in the court system at all. And then in 2009, we were able to expand again through a grant, and we started at that point to serve young people in that transition age bracket differently, and developed the OER program in order to target resources and supports in transitional ways. And then in 2015, we again expanded because of a first episode psychosis grant, and we're able to develop our core program, which serves primarily young people who are experiencing first episode psychosis or who are at high risk for psychosis. And then again in 2017, we expanded, and we included comprehensive community services as part of our system of care. So it's a different program, and now CCS has sort of expanded beyond our traditional wraparound programs. And we're able to, with CCS, then serve young people longer, right? So we were able to sort of serve across the lifespan because CCS is a lifetime benefit, as well as utilize our services that are more youth targeted to assist with the transition into adulthood up to age 23, so that young people were not at 18 launched into the adult services world where there isn't as much support, or the service delivery model is different. And so we wanted to be able to offer that transitional space for young people to still receive the high level of support and resource from our youth and young adult serving systems before sort of transitioning fully into the adult world. And then in 2020, we received a SAMHSA grant and were able to expand yet again. And so we moved way upstream at that point and created our Youth Connect program, which was targeted to be a short-term intensive care coordination program that served young people and families who were not otherwise system involved. So they weren't involved in the mental health system or any other system, didn't necessarily have access to resources and supports, and were maybe just beginning that mental health journey. And so we wanted to be able to be that sort of launching pad that can help young people and families to identify supports and resources in their communities, and or allow for and provide and facilitate a warm handoff into a higher level of care if needed. And so the blended funding structure has allowed us to sustainably continue these programs that were grant funded in terms of startup. And so we do have sort of a number of different ways that we are funded, including case rates from child welfare, from youth justice. We also receive capitation rates from Medicaid, and then CCS is a state funding structure. Crisis billing under DHS 34 is another sort of funding resource and stream for us. And then of course, grants, which have been a big part of our expansion. And all of those funds are pooled together in a braided funding structure that allows us to then operate as a behavioral and mental health HMO to some extent. Some of our programs are HMO, some of them are not, but allows us to create essentially a provider network of traditional and non-traditional mental health services that young people and families then have available to them in ways that they would not otherwise. Things like equine therapy, yoga therapy, parent assistance, those kinds of things. So we have our provider network, and then we also have 10 care coordination agencies that we contract with to provide the care coordination to families, connecting them with community resources and providers from our network. And then additionally, the funds allow us to fund advocacy services. So we have PSL is our advocacy agency. So they work with us to ensure that we have advocacy for young people and families in our systems of care, but also more largely and broadly. And then our Owens Place Youth Drop-In Center, Community Drop-In Center, that's available to any youth in the community age 16 to 23. So the role of grants has been significant for us. Not only has it allowed us to develop startup programs, but also it's allowed us to create new positions. And so some of the programs, again, that we were able to develop because of grants included our OER Youth Transition program, Owens Place, the Community Drop-In Center, Youth Connect, and Youth Crisis Stabilization Facilities, which are short-term stays for young people who are experiencing a mental health crisis and would otherwise be hospitalized or have placement disruptions and things like that. And so it's just a high-intensity supportive space for them to use as a step down, perhaps, or as a diversion from some of those deeper end hospital services. The positions include things like parent-peer supports, peer supports. We were able to hire on a housing specialist, especially for our youth in transition, and also a benefit specialist, again, especially for our youth in transition. And I can certainly appreciate what somebody on the panel had mentioned in terms of access to healthcare. It is so vitally important. So we wanted to make sure that we had resources internally that could support that. And then with that, we were able to build in sustainability. So like the certified peer and parent-peer supports were able to be sustainably funded through other financial resources. They are a reimbursable service. So we were able to bring them on and get them trained up and certified through grant dollars, but sustained through reimbursement dollars. And then other positions have been sort of folded into our admin costs. So I will, with that, hand it over to Dr. Goldfarb to talk more specifically about our OER program and youth in transition.
Hi, everyone. I'm so pleased to be here. Leanne, are you going to continue to click? That would be great. So I'm not going to, our time is kind of limited. And what I'd like to do is use OER as an example of how we started as a grant and how the program not only became integrated as part of our whole HMO and part of our programming for youth and young adults, but also how it actually dictated how we went through and created policies around it. So just so you can see this very quickly, we started out in 2009 with 25 youth. And by the end of 2018, which was 4 years after the grant, we had served 756 youth. And during the period of after the grant, 2014 to 2018, we served 469 transitional youth and young adults. So it's quite a substantial number. Next slide, please. Thank you. So this is just lays out the creation of an evolution of the OER timeline from 2009 all the way through to 2020, in which the OER program became an integrated process of CCS. What I want to say here, which is really, really important, and I'm going to borrow a statement from architecture, which is form follows function. Okay, and with that, I want to illustrate how the program purpose, ultimately, which is the function, led us to create the form itself that it would take, both the structure and the policies that came within it. So hopefully you'll see that as I move on throughout the rest of the presentation. Next slide, please. So one of the first things we realized is that if we were going to create a program that was completely different and separate from the wraparound program, that would create a challenge in terms of what is it going to look like, what is the purpose of it, where are our values and principles, and how do they are they integrated into this brand new program. And as you can see, our values and principles, which are wraparound values and principles, and you can see them all there, are essentially the same as they are for the rest of the programming. The difference is that we felt that because of the unique population, there were a few things that we changed or added to it, which is, I think that's more accurate. Added, it was a person-centered approach. These are young adults. They have some level of autonomy, and therefore we needed to look at them with family when possible, but also looking at what they were already, they had a voice that needed to be heard, and domain driven rather than specific needs driven. The lesson here is very simple. Establishing program cohesiveness allows for policy integration and enrollment flexibility. And that's what we were looking for. Next slide, please. It's no different here. You can see the wraparound, the wraparound, 4 phases of wraparound mirror image of, oh yeah, the words are a little bit different because we're looking at a different population, but essentially it's the same. It's relationship formation, engagement, planning, initial planning, domain review, needs review, action, plan implementation and refinement, and then obviously plan completion and transition, transfer of learning and leading. It's virtually the same thing. And the policy, if you could click for a second, the policy is parallel model structure allows for training, for fiscal and practice efficiency. And both are domain-based to focus on interventions. So although the model is different, slightly different, it parallels each other, it fits together, and therefore the policies we need emerge out of that in very similar kinds of ways. Next slide, please. The same goes for fidelity. If you have a model in which you want to make sure you want to ensure the integrity of the wraparound model, and you're using a similar, if not almost identical model for, oh yeah, then you have the same fidelity measures. Now, some of the standards and the average, you could see the results here, level of enrollee satisfaction, percent of biweekly contacts, domain-based plans, the expectation of what they look like are very, very similar than what you saw in wraparound because the models are integrated and similar. Next. So fidelity standardization assures that the model is being honored across the program experience, no matter for staff and youth, no matter what the differences might be between, oh yeah, the OER population and the younger wraparound population. Next slide. So we also, some of our statistics and our outcomes kind of guided where we were headed in terms of policies and in terms of taking something that has function and moving it into a form that makes sense. So as you can see here, the average length of stay for youth who completed the program was the highest for those who referred to adult programming. Those who completed the program was a little less, 24 months, and services not desired, still staying at 18 months. And those that were unable to contact stayed also 13 months. So the completing of the program and referred to adult programming kind of put a large percentage of youth that we felt needed more service beyond what OER could do. And so with that, we began to look at CCS as an opportunity to eliminate the gap in care. So they went from children, they went from OER to children's a comprehensive service, and then to the adult service. And that eliminates a gap in care that we initially was the purpose of creating OER in the first place. Next slide, please. Again, we began to monitor the transfer of learning and leading. And what we found is that, you know, what was really happening is the percent of change of the youth's feelings about themselves and their well-being was actually the highest percent of change that was happening. Social connectiveness did not necessarily happen. Everyday living did increase, but not as high as feelings. And so we're learning lessons of how to measure success. And success must be measured by the feelings rather than the specific needs met. And the greatest impact has been and continues to be self-esteem. Next slide, please. So we also monitored negative symptoms. So that also was a gauge of transfer of learning and leading. And what we found is that hospitalization remained stable at 4%. And you can see in the far right columns that you can see young adults throughout Wisconsin during the last 3 years was increased, doubled in the last 3 years from 250 to 500 per year. Emergencies attentions increased, and reincarnation rates also increased in the general young adult population. However, in youth that were in OER, it remained very small and very stable in terms of hospitalization and recidivism rate. So the policy lesson is significant reduction in negative symptoms and costly services such as hospitalization led to looking at a sustainability plan for the program. All right. Next slide. Also, we started looking at remember, we went from specific needs to a domain structure. And what we found is that the mental health and the transition to adulthood were the greatest needs, followed by education and vocational domains. Okay, you can see the data there, but the lesson is that they're interconnected. The four domains, specifically education, vocational or career, mental health, and transition to adulthood, are quite formidable, and they are strongly interconnected and therefore need to be addressed as a whole. Next slide. I also were curious about what was happening to those youth that left the program, because they still stayed in the program quite a long time. And what we found is that those youth who left the program ultimately had the highest percentage of needs across both domains. And there was some hypotheses that we kind of to formulate that the youth who leave the program appear to have the greatest number of needs across all domains. Do they leave because they're discouraged? We don't know. But we started looking at what can we do within the program to keep youth longer, because it's not like they came and they left in 2 months. They really stayed an average length of time of 12 to 18 months. And therefore, the needs were they either were discouraged or they felt that they couldn't manage it within the structure, which led us to building other programs such as Owen's Place, expanding it, bringing it into the community so there'd still be resources for those who did not want the structure of OER. Next slide. So essentially, I think what I'm saying, if we look at form following function, is that the function of providing services for youth in a consistent manner, which has the strong foundations of wraparound philosophy, was the same no matter what program the youth was in. All right, that stayed the same. The delivery or the essential model stayed the same. So the policies followed that. We had very few individual policies that that were necessary. Essentially, we monitored fidelity the same way. We looked at outcomes and created an integrated service so that they could move from, which was the whole purpose of what we were doing, so they could move from wraparound into children's CCS, into adult CCS if they desired, into Owen's Place. We even had at one point the flexibility. We had a justice point piece that also went along with the program, so that youth that were an adult were in adult justice systems could then, as they move out, move into some supportive services. All that was created with no change in policies at all. And we have many, many, many policies, but those policies stayed the same because we weren't recreating anything. What we did need, however, were a couple of new policies that related to specifically transition. And there were only two, right, that allowed us to bridge the transition from youth to young adult, or youth to youth and young adult to adult programming, which is these two specific ones: the CCS transition for youth and young adult, which delineates the process of transitioning the youth and the records from the youth program to adult program, and number 086, transition to adulthood, which delineates the activities that assist youth during the transition into the adult program. So essentially, this, in some ways, it's a policy heavy program, but it's tried and true policies that we knew already established to support the wraparound philosophy, which are ultimately what our purpose is. And our purpose in OER was to bridge that, get that cliff out of there, bridge the gap between services for youth to young adult and young adult to adulthood. And that all we really needed was two policies to help them through the transition from one program to another. And just so you can see, these are the voices. These are actual quotes from youth and their transition coordinators. And all of these speak to, and we have to listen to these voices and speak to, yes, they did learn a whole lot of things, but mostly it addressed their belief in themselves. It addressed their confidence, their resiliency. And that ultimately was the biggest change that came about. I think that's it, Leanne.
So you can see in terms of our system of care, while we started with one program and 25 youth in 1995, we today have a fairly expansive system of care, and on any given day serve about 1,400 youth and families. And so you can see from this sort of schematic, we have on one side supportive services and resources that are outside of our program delivery model, but very much connected to, and that includes a mental health clinic, so that when young people enroll in our programs, we have direct connection to psychiatric care for them. And so it creates a more cohesive team planning process and communication sharing or information sharing through connected communication, both within our electronic health records and also from the youth and family team process. Mobile crisis is a strong support for the young people that we serve, and from an integrated, Milwaukee County very much embraces the one front door philosophy. And so recently we've joined forces between our adult mobile crisis team and our youth mobile crisis team. They now exist under one umbrella with some specialty care within it. But we really wanted to recognize that over time, young people can develop relationships with folks that are part of their care team and some of these additional resources. And we wanted to be able to allow those relationships to continue as they transition into adulthood. Our trauma response team is a part of that. So when folks experience potentially traumatic events, like intimate partner violence or a house fire or gun violence, that we are able to respond more immediately to mitigate impact and to provide resources. Again, the youth crisis stabilization facilities are available for young people who are experiencing mental health crisis as a way to, again, reduce the amount of time spent in hospitals as a step-down resource, also as a diversion resource when young people don't necessarily need to be in a hospital or in the emergency room. Additionally, we really work hard to ensure that there is direct access to the youth crisis stabilization facilities in order to avoid law enforcement contact, which is in Wisconsin the way that young people, anyone actually gets access to psychiatric care. And then within the green box in the middle, you can see our actual program array, and that includes, again, comprehensive community services, which is a lifetime benefit so long as the need continues. Nested under CCS is OER, right? We've integrated that program into CCS. And then our specialty program, the first episode psychosis program. Wraparound has been our longest standing program. That's how we started in 1995. And again, was connected to court orders. So Wraparound is part of the court order and allows for the authorization of out-of-home care when necessary. We, however, do again philosophically believe that people belong with their families, in their homes, in their communities. And then reaching, engaging, and assisting children and families, the REACH program, is a slightly lesser intensive program than Wraparound. However, it's more intensive than comprehensive than CCS. So we have sort of a broad array of intensities and lengths of programming. And so we're able to really seamlessly help young people move through, as Penina was talking about, sort of behind the scenes. We can do what's needed in order to help folks move through the system of care based on their existing need, their existing sort of desire for services and supports. And then outside of that, we have our FIST program, which, similar to Youth Connect, is intended to be sort of a pre-system involvement program that can support young people and families and young adults from becoming system involved. Family advocacy provides advocacy directly to families and young people, also to ensure that we have a governance committee, that we make sure that youth and young adult voices and family voices are not just heard, but are really integrated into the conversation about policy changes, about program development, and sort of at a systems level, that they're at the table and given space amongst system partners to really make key decisions that impact care. Owen's Place, again, was the outgrowth of the original grant that we created with OER or created OER with. And we've discovered, as Penina mentioned, right, that having a space for young people who are no longer involved in programs, and for young people who are involved in programs, to go to be their space that is developed and designed by them, for them, where they can get the resources and supports they need in the ways that feel right, in the ways that feel helpful. And then resource extension is our technical assistance arm. And so we are able to provide program development support, policy development support, training and workforce development support to others across the nation, just using the lessons that we've learned, using the experiences that we've had to develop the system of care. We want to be able to offer that that as a resource to others. And then our educational liaison is the special education advocacy arm of Wraparound Milwaukee. And again, school is such a critical component of development, of transitioning into adulthood successfully. And we wanted to make sure that young people had access to specialized advocacy in that realm. And then, oops, it's not moving. So again, you can see here kind of the breakdown of the enrollment across our system of care. CCS is our most significant program at this point, partly because we've been able to nest other programs under CCS, which has again allowed young people to continue to receive care through young adulthood, through the transition to adulthood into adult-focused service delivery systems. And so it's a quite an expansion from 25 youth to 1,400, and we're very, very proud of that expansion in terms of being able to offer access to care to a broader swath of individuals in our communities who need it. And who we hope to become. So we really do a lot of work around strategic planning and ensuring that we continue to evolve as a program, to be more equitable, to be more responsive, to really, gather data, good data from the people that we serve and from the outcomes that we measure, to be able to make decisions about how we provide programming and continue to expand our fiscal resources in order to ensure sustainability. And so you can see here the 6 initiatives that we have that we're working towards with our strategic plan. And so really wanting to position ourselves as thought and practice leaders in integrative and holistic care. And that's a big part of the one front door philosophy and process of ensuring that no matter where somebody comes into care, they have access to what they need directly. To really be leaders in the sustainable development of a dynamic and sophisticated workforce. And so we've done a lot with our technical assistance branch to ensure that we can provide training and workforce development that speaks directly to the needs of the people that we serve and the communities that we serve in. Influencing state and local policy, we want to make sure that we are advocating, especially through our advocacy our advocacy provider, that we are really a voice at the table in making decisions and ensuring that young people and families needs are recognized and considered in that process. To really be a national leader in progressive and innovative community-based care across the lifespan. So again, this is another area where CCS has become helpful for us to be able to ensure that we can serve from, across the lifespan, and that young people, families, and sort of adults are not experiencing disruption in care because they have to leave one system and go to another, that aren't talking to each other, that are not, sharing information and resources, that there is in fact a warm handoff through that process. In addition to the fact that young people come with adults attached to them. And so we want to make sure that the adults involved in the lives of young people have access to their own set of resources and supports as well. And so we can identify young people in need of supports through our adult services and vice versa, that we can recognize when we're working with young people, there may be adults in their lives that also need support and resources, and to be able to integrate that care. And then expanding the fiscal streams is something that, again, we continue to work towards, both from a policy standpoint and reimbursement standpoint with the state, but also from, a grant perspective in terms of being able to really fund new and needed startup programs. And then equity. Equity is always at the top of mind as we continue to develop programs and reassess and evaluate how we function to really be inclusive and equitable practice leaders. And a big part of that includes ensuring that the workforce is reflective of the communities that we serve. And so we've done a lot of work to ensure that we have peer and parent-peer supports to be part of every facet of what we do on our administration team, as service providers, as advocates, and really ensuring that folks are getting what they need and have equitable access to resources and supports. And so again, that one front door approach is really about integrating our efforts in order to minimize disruption for the folks that we serve. We have a couple of programs that have been integrating and integrated in the recent years. So our Disability Services Division has integrated along with our other youth serving systems And CCS for youth is now nested under a single CCS umbrella, so that the adult providers and the youth providers are now sort of joined in their program and in their function, so that we can again ensure that we are keeping a holistic lens of the lifetime needs. And with that, I will just say thank you again for the opportunity to present. Thank you for the opportunity to share what we do and how we're doing it, and for the opportunity to learn from you all as we sort of go through this question and answer process and evaluation of our policy. So I'm not sure what the next steps are here.
Thank you so much for your presentation. I think I can say for all of us that we learned a lot about this really amazing and awesome program and service care model. We're going to open up with some questions and answers. And I think, Need, you want to start?
So in your presentation, you guys mentioned about the evaluation and implementation process review. And I was wondering, like, how were youth involved in the evaluation of your OER, and what are some ways youth voices were integrated?
Anina, do you want to take that?
I can start. I think I want to start by saying that we have made a number of efforts over time. I would say that is probably the least successful of the kinds of initiatives we've done, and I say that perhaps because I think in Owen's place they have a very large voice, an extensive voice in terms of through the evolution of OER. I personally ran a number of focus groups trying to get input. I think that the young adults needed, it's kind of like which comes first. The young adults needed models, and we needed young adults to be models at the same time. And I think it's been a challenge. It has been a challenge accessing their voice and hearing their voice. I do believe that it is an ongoing process, and one of the things that I know we talked about was setting up the expectation when a youth comes into the program, letting them know that their voice is needed right from the start. Because when we started, we weren't setting that expectation up, and it was hard to pull youth in, and they did not understand, and they were hesitant, and we tried to train them on that it's okay to speak within a group and to understand what's happening there. But it's taken a lot of hard work, and I think we can continue to do that better. I think that at Owen's place, they have been much more successful because it is literally run by youth. We have a bit to go. We do not do it perfectly, but I'm beginning to learn to ask them up front and tell them up front what our expectation is. And I think the merging of CCS, the children's CCS with adult CCS, has also made a difference, because they are a more visible partner in the team than when they were in Wraparound. So I think that helped a little bit, but we could learn from others, actually. And I do think that when we talk about form following function, I do believe that some of the evaluation data allows us to further think about what the needs are and bring people in to ask questions, bring youth in to ask questions about it, to understand it better, specifically related to the youth that left the program. Why did they leave the program? That's a question that I tried to get at. I actually did a bunch of interviews with youth. early on. And again, I was unsure that they trusted to express what they wanted, or they were unclear in some fashion, or they were, I think, just like everybody else, we're on a continuum, and on that continuum, the level of comfort level of being candid or understanding what's happening to you also varies. And so we still need to do some work on that for sure. Leanne,
yeah, I would also add to that, we did have a youth council for many years. And what I think learned through that process is that I think we did not necessarily have a solid grasp of how to engage youth differently than how we engage others. And so that was a big learning curve for us, just to get youth to the table, young adults to the table. And then what we learned from those who were at the table is that keeping them engaged really meant that we were offering meaningful opportunities. And so, for example, we had a lot of engagement when we had something specific that we were working on. So we host a talent show every year. And so when when youth were involved in the planning and implementation of the talent show, there was a lot of youth engagement. But in between sort of those more targeted projects and things that we had sort of identified as meaningful opportunities, we lost some youth and folks coming to the table. And so we've said that group has since disbanded in large part because of attendance issues and engagement issues on our end, the engagement challenges, because we didn't do a good job of that. And so understandably, folks were like, there are other ways that they opted to use their time. And so, to echo what Panina is saying, we're still very much learning how to do a better job at that. Our family advocacy organization does have as part of their contract, they do provide spaces for youth to come together and learn. There are educational opportunities. There are opportunities for them to participate in the governance council or the governance committee and things like that. But Owens Place has been absolutely, I think, the space that has been youth driven, youth focused, youth voice has been the loudest and most influential there.
So using the analogy of form follows function, is that Owens Place by its design was all purpose was to sit to establish a youth voice and for them to come in whenever they wanted to. And with that actually evolved into the idea that they can actually speak. We somewhere a number of years ago, we tried to get youth to be involved, to be peer specialists. And in the state of Wisconsin, you have to, like many other states, you have to be certified to get paid, to make it a viable employment option. And certainly we had many people who went into the program, and we tried to support them in that program. We provided extensive education. We gave them opportunities to learn over months in preparation for the state test. And what was discouraging is that these youth had really big challenges passing the state test. And the state test, in fact, we actually gave the feedback to the state, because I do not believe it was the youth's problem. They were quite capable of learning, but they, after taking it several times, they became discouraged because they could not make it happen for themselves, not with the structure that is there. The state needed to require, throwing the state under the bus, I don't mean to, but the state needed to look at the way they were testing the youth, to given the population it needed to be different, and we could not influence that. And so less and less people started coming in to take the course and to get state certified.
There continues to be only generally a less
Yeah.
than 70% pass rate on the certification exam.
Right.
So we were able to advocate for the parent peer support redesign. So they are currently redesigning that curriculum and exam. But we've not made headway on the peer side.
Answer. It was nice to hear about your honesty on what improvements you can make and like any future plans on what you're gonna do with the OER program.
I have a quick question. What unintended, if any, consequences have come for
I'm sorry, I don't think I caught the end of that question. The consequences that have come from implementing?
yes, if any?
I think the consequences for implementation have been largely positive. We've definitely been able to engage young people differently and more meaningfully and longer in our service delivery system, in terms of being able to, again, offer that seamless transition in care. I think young people are receiving more targeted and appropriate support as they transition into adulthood, because the programming that we've historically provided and the processes that we built around that programming were very family driven. They were very, youth driven, and the integration of and the implementation of that program, and now the integration into the CCS program, I think has definitely caused us to pause and say, how are we doing this and why are we doing this? And does it meet the needs? Does it sort of fit with what feels right and helpful to the people that we're serving? And as Penina mentioned earlier, we did have to adjust some policies. We did have to adjust some of the ways that we looked at treatment planning, that we looked at care planning, even to the point of how we look at the frequency with which we see young people or young adults, right? Because not every, young adult wants to be seen every week, or they don't necessarily, how we thought about the child and family team process, right? So in our wraparound process, we very much encourage families to bring their natural and informal supports to the table. And we want lots of people involved, and we really want to, hear from everybody and create this robust system of care around them. Adolescents, young adults were kind of like, nah, I don't know. I'm not interested in that level of, or that type of, they want a lot of support, but not necessarily did the young adults want to, bring their friends to the meeting. Understandably so. So we had to really reevaluate how we looked at support systems and how we measured, support systems and how we engage support systems differently. So I think that's a positive consequence, because it provided, again, more appropriate and helpful care.
And it did, but simultaneously we could still maintain the basic foundational philosophy of wraparound and its values, which we live by every day. I think another positive is that we can actually support, because the CCS has a different funding stream through the state. Youth that were not able to access services under our wraparound HMO could now access services just by virtue of the fact of being part of Children's CCS, which did not exist prior to 2017. And so now that it exists, it becomes kind of an integrated piece, and it allows many youth to get services that they would not have ordinarily been eligible for.
I'll also share, I think one of the, I don't know that it was a negative consequence, but it was a challenge, was helping the workforce to operate within the realm of the wraparound philosophy and process, and also provide individualized care and programming for the older youth and young adults that we were serving. For example, right, we did training all together, and there was a lot of like, well, but that doesn't apply, or that's only for those, those programs. And so there was a bit of rub there in term, as we figured out how to provide integrated care. There was a bit of rub in that arena, to really understand how to create a plan of care with a young person from the perspective of the young person versus kind of how to create a care plan that's inclusive of a whole family. And so it created opportunities for us from the training lens to really assess how are we talking about these things and how do we make it meaningful for everybody who's serving, you know, young people and young adults and families under the same philosophy and process, but in unique and individualized ways. And so, for example, we changed our entire crisis planning process to be from the lens of the young person. So everything now is in I language, so that it's a true ownership of the plan. And when people read it, it comes from the youth and young adult lens, as opposed to, you know, Johnny and sort of that third party kind of lens. In the same way that we've adjusted the family narrative to be a life story and can kind of capture, you know, sort of from the perspective of whether it be the whole family or from the young adult that is telling the story, that we've been able to sort of adjust some things to make it, you know, make it usable and helpful and meaningful to everybody that we serve, because we didn't want to have this continued like exception or branches. We really wanted to function under the wraparound philosophy and process and find ways to do that cohesively and also in an individualized way.
It's almost counterintuitive that the fact that we have almost identical policies that kind of move from can easily fit and transition from program to program, maintaining the same base. One might think it becomes rigid, and in fact, it becomes more flexible. You can do so many things because the policies are open enough to incorporate all programs, as long as we maintain the foundation of what we believe it to be best practice for everyone.
Did
Thank
that
you.
answer the question about unintended consequences?
Yes, it sure does.
Okay.
My question is more about the relationship between Owens Place and the wraparound. Are the services criteria the same? What's the referral process?
Sure. So Owens Place is a community drop-in center. Wraparound funds it, but it's open to any youth. 16 to 23 is the target population. They can come anytime. There is no referral. There is no criteria. They simply show up and receive support. And it's connected also to Wraparound in that we really encourage the youth who are enrolled in Wraparound to go and utilize that resource. And we'll hold child and family team meetings there. You know, we really want to start upstream to get young people connected to Owens Place, even at 13, 14, 15, so that it is a place that they feel safe and connected to moving into that transitional stage. Owens Place also offers a lot of like programming, educational programming and other programming that Wraparound supports. So like we might offer a training there. We might offer, you know, we actually use Owens Place as our home base for our grab and go events, which again are open to all of the community and really marketed to the families enrolled in Wraparound programs, which is just, again, it's just essentially a resource fair every like one Wednesday a month, where families can come in and get clothing, they can get resources, they can get household items, they can get food. So we're connected in that way, but the functioning of Owens Place is really, we leave that to the folks that are utilizing it as a resource.
Yeah, we actually let go of it because we felt that people in the community could do a better job in terms of, because initially when we first got the grant, it was totally integrated and a branch of what we were doing as part of the grant. And we quickly learned that it needed to be out in the community, not to be in our administrative building. We quickly learned it needed to be driven by youth. We had a membership, a tier membership model, which we still have a membership. They can sign up as an official member, but there are a lot fewer members than that. I just looked at the data. They had like way over 1,600 visits this year in 1 year. And only 180 of them saw themselves as members of Wraparound, but they continually come in for all kinds of services. And it's, you know, it's a social place. It's a place to find employment. It's a place to do all kinds of educational learning. They actually have connected with one of our other grants, which is an employment grant, in which they provide the educational support, the kind of the soft skills that are related to employment. And they also have, which Leanne just spoke about, was the community. They also build community responsibility there. So they support all kinds of things that are happening in the community as well. So I just think that when we tried to force it to be something, it was less successful. When we let it organically grow, and we took our hands off it, it developed. It's a very, very strong program right now. We're actually going to open up another one. Yeah, sorry about that.
No, that's great.
In
Yeah, we
another
are
part of
looking
the
to.
city. Yeah.
Okay, thank you so much.
I also just had a question. Upon reviewing your policy, I saw something mentioned. Could you share more about young people with challenges in multiple domains and why that results in disenrollment and homelessness?
I don't know. Can you put that slide? I don't know what you're referring to exactly. Hold on.
From your slides, it was just from the overall review of all of the services that were provided in the review that you provided to us a while back. It mentioned that some young people that had challenges in multiple domains
Yes.
disenrolled from the program and
Yeah.
resulted in homelessness.
Yeah, well, what we found is, and I tried to go back and kind of find those people and interview them with very little success, actually. So it's really just a hypothesis based on the data itself, and it's yet to be actually, I can't be definitive about it. Certainly there have been very, idiosyncratic reasons, but I found it interesting that youth that seem to have the greatest amount of needs and domains, and somehow, and it sounds, because they stayed the length of time that they did, it's almost like they gave it a try, but it just overwhelmed them to a point where, and we did track some of them, and that indeed many of them ended up in homeless situations. And I think looking at that data, one needs to begin to wonder what it is that, why are they not staying? And I think there's a level of discouragement that comes with that, but it also allowed us to find different ways, like the support of Owens Place, as means of youth that just lost their way in terms of getting their needs met through the formal programming, and yet allowing them opportunity to come back in some fashion. We did an initiative a number of years ago where we actually contacted youth that left OER, and we did it through texts and through emails as best as we could, to not to ask them why, but just to simply remind them that they could come back. They could come back through coming back to Wraparound, connecting through our front door referral line, and or they could come back by entering and going through Owens Place. And there were a number, I think there were a number that did come back through Owens Place, and one or two that came actually back to their care coordinators and saying, we need help now. We weren't ready now. I feel like they somehow there's a pattern that I have not figured out at all, of what the buildup of needs becomes so overwhelming that youth kind of give up. And then what it takes to come back and rise up again and ask for help. And I don't know what the formula is. And the problem we have is access to youth. We don't hear them. Once they leave, we try really hard to keep in touch. It's very challenging.
There are also, because we are Medicaid funded, there are also rules about that. We're not allowed to contact once they've left the HMO. CCS is slightly different. What Youth Connect is slightly different, but any youth who is enrolled in our HMO, we're not allowed to reach out to, which
So,
makes
Leanne, what we did is actually we created a release that included from upfront where that allowed us to go ahead, if they signed it, that we could contact them after they left. And it was right in the release of information. So that's the way we got around it at that time.
Thank you so much for sharing all of that information. And I really appreciate your honesty and just like, look, sometimes we just really don't know, but we're trying our best to figure it out. One thing that I'd like to add, just from a lived experience lens that may be helpful to you, paid surveys, incentivized surveys, do a little Google form, give them a virtual gift card, collect social medias. Sometimes our phone numbers won't stay the same, but my Facebook's been the same since I was 13, right? So I really hope this succeeds for you, and I hope you get more feedback from your young people, because I do believe you are committed to fixing that issue that you're seeing.
Thank you. That's really helpful.
There was one quick question in the chat before I turn it back to Trace and the panel. Lisa had just asked, is Wraparound still a strengths-based program with voice and choice?
Absolutely. Those are our core values, and we will maintain them as we grow, as we evolve. Those are still fundamental to who we are.
Thank you so much, Leanne and Dr. Goldfarb, for this presentation. We all learned so much, and we are going to go for a 30-minute break and return at 11. And thank you so much again.
Thank you. Thank you for the opportunity.
Thank you very much for the opportunity. Yeah.
Right. Enjoy.
Bye-bye, everyone.